what's in this bill. I mean, I was watching Senate debate the other day.
Yeah.
Senator McCain got up on the floor and said he couldn't find out exactly what was in the bill. And Senator Durbin, who's is part of the leadership of the Democratic Party, responded, and I want to put these words up on the screen. He said, I would say to the senator from Arizona that I am in the dark almost as much as he is, and I am in leadership.
Yeah.
Why is it nobody knows what this proposal is that was sent?
Yeah, let me just think, right,
to the Congressional Budget Office.
Right, a very important question, right. On the basic bill, about 2,000 pages, we all know what's in it. But on this, on these compromises, which my friends tell me really we're not agreeing on, as Ben said, but just they agreed that they were interesting enough to send to get analyzed by the Budget Office. Senator Reid has decided that if you let them out, they'll get mauled. And it puts us all in a very difficult position because we don't know exactly what's in them. But I will tell you that on one part of it, the so-called Medicare buy-in, the opposition to it has been growing as the week has gone on. And though I don't know exactly what's in it, from what I hear, I certainly would have a hard time voting for it because it has some of the same infirmities that the public option did. It will add taxpayer costs. It will add to the deficit. It's unnecessary. The basic bill, which has a lot of good things in it, provides a generous new system of subsidies for people between ages 55 and 65 and choice and competition. So, you know, Bob, I think we're at there are not 60 votes for health care reform in the Senate now. We're at a point where, and yet the basis of the bill, covering 30 million people who can't buy insurance today, regulating insurance companies so they treat consumers more fairly, for instance, not denying them health care insurance.
So you can't vote for the bill right now. You can't vote for the bill right now. So why do you think that it's going to pass, Senator Rockefeller? Because we know this is going to be 1 or 2 votes here.
Know that. And the reason that it has to be 60 votes, the reason it's so difficult is because every single Democrat and independent has to vote for it. Mm-hmm. You see, because the Republicans are withholding all of their votes and have been throughout the entire process. And that has to be said to the American people. I mean, it's very hard to pass a bill under any circumstances, but when everything is filibustered, you have to get 60 votes. It's very, very hard. But I feel that way, that it can pass or will pass, because as I say, I think the closer you get, the more you have to look at the whole bill, the more likely you are to say, I have to do this for the nation.
Bob, as I was saying, there's a good basic bill in here, and the parts of it can be supported by 60 senators, including some Republicans. But we've got to stop adding to the bill. We've got to start subtracting some controversial things. I think the only way to get this done before Christmas is to bring in some Republicans who are open-minded on this, like Olympia Snowe. I'll tell you.
Well, what do you have to do that?
You got to take out the Medicare buy-in. You got to forget about the public option. You probably have to take out the Class Act, which is a whole new entitlement program that will, in future years, put us further in the deficit. And you got to adopt some of the cost containment provisions that'll strengthen cost containment that all of us favor. If you did that, you'd have an enormous accomplishment. 30 million Americans who can't afford insurance today would get it. Insurance companies would be more aggressively regulated and costs would be bent down. So it's time to get reasonable.